81. A nurse is caring for a patient with a wound that is healing by primary intention. Which of the following is most important to monitor during the healing process? A. The presence of purulent drainage. B. The amount of scarring. C. The appearance of the wound edges. D. The patient's level of pain. Answer: C. The appearance of the wound edges. Rationale: in wounds healing by primary intention, the wound edges should be approximated and without significant gaps. Monitoring for infection, e.g., purulent drainage, is also important but secondary. 82. A nurse is caring for a patient who has a history of constipation. Which of the following dietary recommendations is most appropriate? A. Increase the intake of fiber. B. Decrease fluid intake. C. Increase intake of fatty foods. D. Limit physical activity to avoid stress. Answer: A. Increase the intake of fiber. Rationale: a high-fiber diet helps regulate bowel movements and prevent constipation. Decreasing fluids or limiting activity would exacerbate constipation. 83. A nurse is providing care for a patient recovering from a mastectomy. Which of the following actions is most appropriate to prevent lymphedema? A. Encourage the patient to perform arm exercises. B. Elevate the arm above the head. C. Avoid using the arm for daily activities. D. Avoid applying pressure to the arm. Answer: A. Encourage the patient to perform arm exercises. Rationale: arm exercises help reduce the risk of lymphedema and improve circulation. Elevating the arm is important, but should be done in conjunction with exercise. 84. A nurse is caring for a patient with a chronic wound. Which of the following is the most important intervention to promote wound healing? A. Keep the wound dry and free from moisture. B. Ensure the patient has adequate nutrition. C. Clean the wound with hydrogen peroxide daily. D. Massage the wound to promote circulation. Answer: B. Ensure the patient has adequate nutrition. Rationale: adequate nutrition, including protein and vitamins, is essential for wound healing. Keeping the wound dry is important, but secondary to ensuring proper nutrition. 85. A nurse is educating a patient about the importance of sleep hygiene. Which of the following statements indicates that the patient understands? A. I will avoid drinking caffeine in the evening. B. I will exercise right before bedtime. C. I will nap during the day to make up for lost sleep. D. I will watch TV in bed to help me relax. Answer: A. I will avoid drinking caffeine in the evening. Rationale: caffeine can interfere with sleep, so avoiding it in the evening is an important sleep hygiene measure. Exercise close to bedtime and daytime napping can disrupt sleep. 86. A nurse is educating a patient with diabetes on proper foot care. Which of the following actions should the patient avoid? A. Inspect the feet daily for cuts. B. Soak the feet in hot water daily. C. Wear shoes that fit properly. D. Moisturize the feet to prevent dryness. Answer: B. Soak the feet in hot water daily. Rationale: soaking the feet in hot water can damage skin and increase the risk of burns or infection, especially in diabetic patients. The other actions are essential for foot care. 87. A nurse is caring for a patient with a history of chronic pain. Which of the following interventions is most important for effective pain management? A. Encourage the patient to use pain medications sparingly. B. Administer pain medications on a fixed schedule. C. Teach the patient to tolerate pain. D. Focus only on pharmacological interventions. Answer: B. Administer pain medications on a fixed schedule. Rationale: a fixed schedule ensures continuous pain relief and prevents pain from becoming unmanageable. Tolerating pain is not recommended, and a balance of pharmacological and non-pharmacological interventions is important. 88. A nurse is caring for a patient with a wound infection. Which of the following actions is most important to prevent the spread of infection? A. Wear sterile gloves when handling the wound. B. Keep the wound covered at all times. C. Perform frequent hand hygiene. D. Change the wound dressing every 24 hours. Answer: C. Perform frequent hand hygiene. Rationale: frequent hand hygiene is the most effective way to prevent the spread of infection. Sterile gloves and proper dressing changes are important, but secondary to hand hygiene. 89. A nurse is caring for a patient with an elevated temperature. Which of the following interventions is most appropriate to promote comfort? A. Administer antipyretic medications as prescribed. B. Apply a cold compress to the forehead. C. Increase the room temperature to warm the patient. D. Encourage the patient to wear heavy blankets. Answer. A. Administer antipyretic medications as prescribed. Rationale. Antipyretic medications reduce fever and alleviate discomfort. Cooling methods can help, but antipyretics are the most effective for lowering temperature. 90. A nurse is caring for a patient with a chronic wound. Which of the following dressing types is most appropriate for promoting moisture balance? A. Wet to dry dressings. B. Hydrocolloid dressings. C. Gauze dressings. D. Transparent film dressings. Answer. B. Hydrocolloid dressings. Rationale. Hydrocolloid dressings maintain a moist environment and promote healing of chronic wounds. Wet to dry dressings can be painful and may not maintain moisture. 91. A nurse is caring for a patient with nausea following surgery. Which of the following interventions should be implemented first? A. Administer antiemetic medication. B. Offer the patient clear liquids. C. Provide a cool compress to the forehead. D. Encourage deep breathing exercises. Answer. A. Administer antiemetic medication. Rationale. The first-line intervention for nausea after surgery is typically antiemetic medication, especially if the patient is unable to manage the nausea with non-pharmacological methods. 92. A nurse is educating a patient on the importance of hydration. Which of the following statements by the patient indicates understanding? A. I should drink 8 glasses of water each day, regardless of my activity level. B. I should only drink when I feel thirsty. C. I need to drink fluids more frequently in hot weather or during exercise. D. I can avoid drinking fluids if I am not thirsty. Answer. C. I need to drink fluids more frequently in hot weather or during exercise. Rationale. Fluid needs increase during exercise or hot weather, and it is important to stay hydrated throughout the day, even if not feeling thirsty. 93. A nurse is caring for a patient with a new wound. Which of the following should the nurse monitor most closely to prevent infection? A. The color of the wound edges. B. The appearance of drainage. C. The patient's temperature. D. The patient's blood pressure. Answer. B. The appearance of drainage. Rationale. The appearance of drainage, including color, consistency, and amount, is a key indicator of infection. Monitoring temperature is also important but secondary. 94. A nurse is caring for a patient who is postoperative and at risk for deep vein thrombosis, DVT. Which of the following is the most important prevention measure? A. Encourage the patient to walk every few hours. B. Ensure the patient wears compression stockings. C. Administer anticoagulant medications. D. Perform passive range of motion exercises. Answer. A. Encourage the patient to walk every few hours. Rationale. Early ambulation is the most effective method for preventing DVT as it promotes circulation. Compression stockings and anticoagulants are also important, but walking is prioritized. 95. A nurse is caring for a patient who is experiencing pain after surgery. Which of the following actions is most appropriate for pain management? A. Administer the prescribed pain medication as needed. B. Encourage the patient to wait until the pain becomes severe before asking for medication. C. Only use non-pharmacological methods to control pain. D. Assume the patient will ask for pain medication when needed. Answer. A. Administer the prescribed pain medication as needed. Rationale. Administering prescribed pain medication on time helps control pain early and effectively, preventing it from becoming severe. 96. A nurse is educating a patient on the proper use of a walker. Which of the following instructions should the nurse include? A. Move the walker with your weaker leg first. B. Hold the walker with one hand and a cane with the other. C. Lean forward when walking to maintain balance. D. Keep the walker a few inches in front of you while walking. Answer. D. Keep the walker a few inches in front of you while walking. Rationale. The walker should be placed a few inches in front of the patient to ensure stability and proper walking posture. Leaning forward can affect balance. 97. A nurse is caring for a patient with a catheter in place. Which of the following actions should the nurse take to minimize the risk of catheter-associated urinary tract infections, CAUTIs? A. Use sterile technique during catheter insertion. B. Empty the catheter bag every 8 hours. C. Reposition the catheter every 24 hours. D. Restrict fluid intake to reduce output. Answer. A. Use sterile technique during catheter insertion. Rationale. Sterile technique during catheter insertion is crucial to preventing infection. Other interventions, like emptying the bag, are also important but secondary. 98. A nurse is caring for a patient with chronic pain. Which of the following strategies is most effective for long-term pain management? A. Use a combination of pharmacological and non-pharmacological methods. B. Rely solely on medication to control pain. C. Encourage the patient to tough it out without pain medication. D. Administer pain medication only when the pain becomes severe. Answer. A. Use a combination of pharmacological and non-pharmacological methods. Rationale. A combination of approaches provides comprehensive pain relief and reduces reliance on medications alone. 99. A nurse is caring for a patient with diabetes and is providing education on foot care. Which of the following should the nurse include in the teaching? A. You should inspect your feet daily for any cuts or sores. B. You should soak your feet in hot water every night. C. You should massage your feet vigorously to improve circulation. D. You should avoid wearing shoes that fit properly. Answer. A. You should inspect your feet daily for any cuts or sores. Rationale. Daily inspection helps detect early signs of injury or infection, which is critical for diabetic foot care. 100. A nurse is caring for a patient who is receiving palliative care. Which of the following is the most important aspect of care at this time? A. Focus on curing the patient's illness. B. Provide comfort and symptom management. C. Emphasize aggressive interventions. D. Prioritize long-term rehabilitation. Answer. B. Provide comfort and symptom management. Rationale. The focus of palliative care is on providing comfort and managing symptoms rather than curing the illness. 101. A nurse is caring for a patient who is at risk for pressure ulcers. Which of the following interventions is most important? A. Reposition the patient every 2 hours. B. Apply a barrier cream to the skin. C. Provide a special mattress for the patient. D. Offer the patient high-calorie snacks. Answer. A. Reposition the patient every 2 hours. Rationale. Repositioning every 2 hours is the most effective way to prevent pressure ulcers by relieving pressure on vulnerable areas. 102. A nurse is caring for a patient with a new cast. Which of the following actions is most important to prevent complications? A. Elevate the affected limb. B. Apply heat to the cast to promote drying. C. Encourage weight-bearing activity. D. Keep the cast covered with plastic. Answer. A. Elevate the affected limb. Rationale. Elevating the affected limb helps reduce swelling and prevent complications, such as compartment syndrome. 103. A nurse is caring for a patient with a wound that is healing by secondary intention. Which of the following is the most appropriate intervention? A. Keep the wound moist to promote healing. B. Allow the wound to dry out completely. C. Apply topical ointments regularly. D. Use wet-to-dry dressings. Answer. A. Keep the wound moist to promote healing. Rationale. Keeping the wound moist facilitates faster healing and reduces scarring in wounds healing by secondary intention. 104. A nurse is caring for a patient who is receiving morphine for pain management. Which of the following interventions should the nurse prioritize? A. Assess the patient's respiratory rate regularly. B. Monitor the patient's blood pressure frequently. C. Encourage the patient to drink fluids frequently. D. Increase the patient's activity level. Answer. A. Assess the patient's respiratory rate regularly. Rationale. Opioids like morphine can depress the respiratory system, so regular monitoring of the respiratory rate is essential. 105. A nurse is caring for a patient with insomnia. Which of the following strategies is most appropriate to promote sleep hygiene? A. Encourage the patient to drink caffeinated beverages before bed. B. Promote a quiet and dark environment for sleeping. C. Advise the patient to exercise right before bedtime. D. Recommend using electronic devices in bed to relax. Answer. B. Promote a quiet and dark environment for sleeping. Rationale. A quiet, dark environment is conducive to sleep and helps improve sleep hygiene. 106. A nurse is caring for a patient who is recovering from surgery and has a low appetite. Which of the following strategies should the nurse use to improve nutrition? A. Offer the patient small, frequent meals. B. Restrict fluids to encourage appetite. C. Serve large meals at regular intervals. D. Offer only bland foods to avoid nausea. Answer. A. Offer the patient small, frequent meals. Rationale. Small, frequent meals are easier for patients with low appetite to tolerate, ensuring better nutritional intake. 107. A nurse is caring for a patient with chronic obstructive pulmonary disease, COPD. Which of the following interventions is most important for promoting comfort? A. Administer oxygen as prescribed. B. Encourage the patient to avoid all physical activity. C. Restrict fluid intake to reduce mucus. D. Provide a quiet, low-stress environment. Answer. A. Administer oxygen as prescribed. Rationale. Oxygen therapy is critical for managing COPD and improving oxygenation. Other interventions, such as avoiding physical activity, can limit mobility but are secondary. 108. A nurse is caring for a patient with a pressure ulcer. Which of the following is most important in the management of the ulcer? A. Keep the wound dry and open to the air. B. Apply moist dressings to promote healing. C. Expose the wound to sunlight for faster healing. D. Leave the wound uncovered to air dry. Answer. B. Apply moist dressings to promote healing. Rationale. Moist dressings maintain an ideal environment for wound healing and reduce pain. Keeping the wound dry or exposing it to sunlight can hinder healing. 109. A nurse is educating a patient who is recovering from surgery on the importance of mobility. Which of the following statements indicates understanding? A. I should remain in bed for the first few days to rest. B. I should perform deep breathing exercises every hour. C. I should avoid moving to prevent injury. D. I should increase my activity level gradually to avoid complications. Answer. D. I should increase my activity level gradually to avoid complications. Rationale. Gradual mobilization after surgery is important to prevent complications such as DVT and improve circulation. 110. A nurse is caring for a patient with diabetes and educating them about foot care. Which of the following should the nurse include in the teaching? A. Inspect feet daily for cuts or abrasions. B. Massage the feet vigorously to improve circulation. C. Soak the feet in hot water regularly. D. Avoid wearing shoes that fit properly. Answer. A. Inspect feet daily for cuts or abrasions. Rationale. Daily foot inspection is key to preventing diabetic foot complications. Massaging and soaking feet in hot water should be avoided, as it can cause injury. 111. A nurse is caring for a patient who is on bed rest and at risk for developing a pressure ulcer. Which of the following is most important to prevent skin breakdown? A. Reposition the patient every 2 hours. B. Massage the patient's skin frequently. C. Apply lotion to the skin every hour. D. Keep the bed linens wrinkle-free. Answer. A. Reposition the patient every 2 hours. Rationale. Repositioning every 2 hours is the most effective method to reduce pressure on bony prominences and prevent pressure ulcers. 112. A nurse is teaching a patient who is recovering from surgery about mobility. Which of the following statements by the patient indicates understanding? A. I should stay in bed to avoid strain. B. I will gradually increase my activity level. C. I should avoid any physical activity until my follow-up appointment. D. I can resume all activities as soon as I feel like it. Answer. B. I will gradually increase my activity level. Rationale. Gradual increase in activity after surgery helps prevent complications like DVT and promotes healing. 113. A nurse is caring for a patient with a history of chronic constipation. Which of the following interventions is most likely to improve bowel function? A. Encourage increased fluid intake. B. Limit the patient's intake of fiber. C. Recommend a low-activity regimen. D. Restrict the patient's fluid intake. Answer. A. Encourage increased fluid intake. Rationale. Adequate fluid intake helps soften stools and improves bowel function, especially in patients with constipation. 114. A nurse is providing education to a patient with limited mobility on preventing falls. Which of the following statements indicates understanding? A. I should keep the floor free of clutter and use a cane when walking. B. I should stay in bed as much as possible to avoid falling. C. I should avoid wearing shoes that fit properly to improve stability. D. I should only move when a family member is available to assist me. Answer. A. I should keep the floor free of clutter and use a cane when walking. Rationale. Maintaining a safe environment and using mobility aids like a cane can help prevent falls in patients with limited mobility. 115. A nurse is caring for a patient who is experiencing nausea following chemotherapy. Which of the following is the most appropriate intervention? A. Encourage the patient to eat spicy foods. B. Offer small, frequent meals. C. Offer cold, carbonated drinks. D. Advise the patient to avoid all food and fluids. Answer. B. Offer small, frequent meals. Rationale. Small, frequent meals can be easier to tolerate and help prevent nausea. 116. A nurse is caring for a patient who is recovering from surgery and is at risk for dehydration. Which of the following interventions is most important? A. Encourage the patient to drink fluids regularly. B. Restrict fluid intake to prevent swelling. C. Offer caffeinated beverages to promote fluid intake. D. Administer fluids only when the patient asks for them. Answer. A. Encourage the patient to drink fluids regularly. Rationale. Encouraging regular fluid intake is the best way to prevent dehydration and maintain proper hydration levels. 117. A nurse is caring for a patient who is experiencing pain from a wound. Which of the following non-pharmacological interventions can be most effective? A. Applying heat to the wound. B. Distracting the patient with music or conversation. C. Massaging the wound area. D. Applying cold to the wound. Answer. B. Distracting the patient with music or conversation. Rationale. Distraction can be an effective way to manage pain, especially in non-pharmacological pain management strategies. 118. A nurse is educating a patient about good sleep hygiene. Which of the following recommendations should be included? A. Avoid caffeine and large meals close to bedtime. B. Take naps throughout the day to ensure enough rest. C. Use electronic devices like a phone or TV in bed to relax. D. Exercise vigorously right before bed to help you sleep. Answer. A. Avoid caffeine and large meals close to bedtime. Rationale. Avoiding caffeine and large meals before bed helps promote restful sleep by preventing discomfort and stimulating effects. 119. A nurse is caring for a patient who is receiving opioid medications for pain management. Which of the following should the nurse monitor most closely? A. The patient's blood pressure. B. The patient's respiratory rate. C. The patient's temperature. D. The patient's urine output. Answer. B. The patient's respiratory rate. Rationale. Opioid medications can depress the respiratory system, making it critical to monitor the patient's respiratory rate. 120. A nurse is caring for a patient with a cast. Which of the following actions is most important to prevent complications related to the cast? A. Elevate the affected limb to reduce swelling. B. Allow the patient to walk as soon as possible. C. Apply warm compresses to the cast. D. Keep the cast uncovered to allow it to dry faster. Answer. A. Elevate the affected limb to reduce swelling. Rationale. Elevating the limb helps reduce swelling and prevent complications, such as compartment syndrome. 121. A nurse is caring for a patient with a pressure ulcer. Which of the following interventions is most important to prevent further breakdown? A. Reposition the patient every 2 hours. B. Apply a pressure-relieving mattress. C. Clean the ulcer with antiseptic solution. D. Avoid using moisture-retentive dressings. Answer: A. Reposition the patient every 2 hours. Rationale: repositioning the patient regularly relieves pressure on vulnerable areas, which is crucial in preventing further skin breakdown. 122. A nurse is caring for a patient who is at risk for malnutrition. Which of the following is the most important strategy to improve nutrition? A. Offer high-protein snacks between meals. B. Offer large, infrequent meals to the patient. C. Limit the patient's fluid intake to promote hunger. D. Avoid providing nutritional supplements. Answer: A. Offer high-protein snacks between meals. Rationale: high-protein snacks provide essential nutrients and help meet the patient's caloric and nutritional needs between meals. 123. A nurse is caring for a patient who is receiving chemotherapy and is experiencing fatigue. Which of the following is most appropriate for managing fatigue? A. Encourage the patient to exercise vigorously. B. Encourage frequent rest periods throughout the day. C. Limit fluid intake to prevent feelings of fullness. D. Advise the patient to stay in bed as much as possible. Answer: B. Encourage frequent rest periods throughout the day. Rationale: frequent rest periods help manage fatigue and prevent the patient from becoming too exhausted. 124. A nurse is educating a patient with limited mobility on techniques for performing activities of daily living. Which of the following should be included in the teaching? A. You should avoid using assistive devices like canes or walkers. B. You should conserve energy by sitting while performing tasks. C. You should always stand up straight, even if it causes discomfort. D. You should limit the use of adaptive equipment to avoid dependency. Answer: B. You should conserve energy by sitting while performing tasks. Rationale: conserving energy by sitting while performing tasks can prevent fatigue and allow the patient to perform tasks more efficiently. 125. A nurse is caring for a patient with a wound that is healing by secondary intention. Which of the following should the nurse monitor most closely? A. The presence of any discharge or drainage. B. The patient's temperature. C. The appearance of the surrounding skin. D. The patient's respiratory rate. Answer: A. The presence of any discharge or drainage. Rationale: monitoring for signs of infection or abnormal drainage is crucial in the healing process of wounds healing by secondary intention. 126. A nurse is caring for a patient with osteoarthritis. Which of the following interventions is most important for managing pain and improving mobility? A. Encourage regular physical activity to strengthen joints. B. Advise the patient to avoid any weight-bearing activities. C. Recommend complete bed rest to prevent joint strain. D. Provide hot packs and massage to the affected joints. Answer: A. Encourage regular physical activity to strengthen joints. Rationale: regular physical activity strengthens the muscles around the joints, reduces pain, and improves mobility. 127. A nurse is caring for a patient who is recovering from surgery and is at risk for deep vein thrombosis, DVT. Which of the following interventions should be prioritized? A. Administer anticoagulants as prescribed. B. Encourage the patient to drink caffeinated beverages. C. Restrict the patient's fluid intake. D. Limit the patient's physical activity. Answer: A. Administer anticoagulants as prescribed. Rationale: anticoagulants are critical for preventing and managing DVT, especially after surgery. 128. A nurse is caring for a patient who is on a high-calorie diet due to malnutrition. Which of the following foods is most appropriate to include in the diet? A. Fresh fruits and vegetables. B. Low-fat dairy products. C. Whole grain bread. D. Avocados and nuts. Answer: D. Avocados and nuts. Rationale: avocados and nuts are high in calories and healthy fats, making them ideal for patients needing additional calories for recovery. 129. A nurse is caring for a patient with a history of falls. Which of the following interventions is most important to reduce the risk of future falls? A. Encourage the patient to use mobility aids, such as walkers or canes. B. Advise the patient to limit physical activity. C. Restrict the patient's fluid intake to prevent dizziness. D. Encourage the patient to wear loose-fitting clothing. Answer: A. Encourage the patient to use mobility aids, such as walkers or canes. Rationale: using mobility aids helps improve balance and stability, reducing the risk of falls. 130. A nurse is caring for a patient who is experiencing nausea after eating. Which of the following is the most appropriate intervention? A. Administer antiemetic medication as prescribed. B. Offer the patient a large meal to help with digestion. C. Encourage the patient to eat spicy foods to stimulate appetite. D. Advise the patient to lie down immediately after eating. Answer: A. Administer antiemetic medication as prescribed. Rationale: anti-nausea medication is the most effective way to control nausea after eating. 131. A nurse is caring for a patient with pneumonia. Which of the following interventions is most important to promote comfort? A. Provide oxygen therapy as prescribed. B. Encourage deep breathing and coughing exercises. C. Increase the patient's fluid intake. D. Administer pain medication as prescribed. Answer: B. Encourage deep breathing and coughing exercises. Rationale: deep breathing and coughing help clear the airways and improve oxygenation, which is important for patients with pneumonia. 132. A nurse is caring for a patient who has recently undergone a hip replacement. Which of the following should the nurse prioritize to promote mobility? A. Encourage the patient to rest in bed for the first few days. B. Encourage early ambulation as tolerated. C. Limit movement to prevent dislocation. D. Use a traction device for immobilization. Answer: B. Encourage early ambulation as tolerated. Rationale: early ambulation promotes circulation, prevents complications like DVT, and improves recovery after hip replacement. 133. A nurse is caring for a patient who is receiving palliative care. Which of the following is most important to provide at this stage of care? A. Focus on curing the patient's disease. B. Provide comfort and relieve symptoms. C. Administer aggressive treatments. D. Limit interactions with the patient to respect their privacy. Answer: B. Provide comfort and relieve symptoms. Rationale: palliative care focuses on providing comfort and managing symptoms, rather than curing the disease. 134. A nurse is educating a patient on how to manage chronic pain. Which of the following strategies is most appropriate? A. Rely solely on medication to control pain. B. Incorporate both pharmacological and non-pharmacological pain management strategies. C. Avoid physical activity to prevent pain flare-ups. D. Wait until pain is severe before seeking relief. Answer: B. Incorporate both pharmacological and non-pharmacological pain management strategies. Rationale: combining both pharmacological and non-pharmacological strategies can help manage chronic pain more effectively. 135. A nurse is caring for a patient who is at risk for developing a pressure ulcer. Which of the following is the most important intervention? A. Reposition the patient every 2 hours. B. Apply moisturizers to the skin. C. Restrict the patient's fluid intake. D. Use a static pressure relieving device. Answer: A. Reposition the patient every 2 hours. Rationale: regular repositioning helps relieve pressure on bony prominences and prevents pressure ulcers. 136. A nurse is providing education to a patient who is at risk for falls. Which of the following interventions is most effective for reducing the risk of falls? A. Encourage the patient to remain sedentary. B. Encourage the patient to use assistive devices, such as canes or walkers. C. Advise the patient to restrict fluid intake to prevent dizziness. D. Recommend the patient avoid exercise to minimize risk. Answer: B. Encourage the patient to use assistive devices, such as canes or walkers. Rationale: using assisted devices helps improve stability and reduce the risk of falls in at-risk patients. 137. A nurse is caring for a patient who is experiencing nausea following chemotherapy. Which of the following actions is most appropriate? A. Administer antiemetic medication as prescribed. B. Offer the patient a large meal to distract them from the nausea. C. Encourage the patient to drink caffeinated beverages. D. Advise the patient to remain lying flat in bed. Answer: A. Administer antiemetic medication as prescribed. Rationale: antiemetic medication is the most effective way to manage chemotherapy-induced nausea. 138. A nurse is caring for a patient with limited mobility due to a stroke. Which of the following interventions is most effective for promoting patient comfort? A. Encourage the patient to lie flat in bed all day. B. Position the patient with pillows for support and comfort. C. Restrict fluid intake to prevent frequent bathroom trips. D. Limit social interaction to reduce stress. Answer. B. Position the patient with pillows for support and comfort. Rationale. Proper positioning with support pillows helps improve comfort and reduces the risk of complications like pressure ulcers. 139. A nurse is caring for a patient who is experiencing acute pain. Which of the following is the most appropriate first intervention for pain management? A. Administer opioid medication as prescribed. B. Offer the patient a warm compress for relaxation. C. Ask the patient to engage in deep breathing exercises. D. Administer nonsteroidal anti-inflammatory drugs, NSAIDs, as prescribed. Answer. A. Administer opioid medication as prescribed. Rationale. Opioid medication is often the first-line treatment for acute pain to provide rapid relief. 140. A nurse is caring for a patient who is recovering from surgery and is experiencing constipation. Which of the following is the most appropriate intervention? A. Encourage increased fluid and fiber intake. B. Restrict fluid intake to prevent bloating. C. Recommend complete bed rest to prevent strain. D. Administer a high dose of laxatives. Answer. A. Encourage increased fluid and fiber intake. Rationale. Fluid and fiber intake helps soften stools and promotes regular bowel movements, which is essential for constipation relief. 141. A nurse is educating a patient on sleep hygiene. Which of the following recommendations should be included in the teaching? A. Engage in stimulating activities just before bedtime. B. Avoid caffeine and nicotine in the hours leading up to bedtime. C. Drink caffeinated beverages before bed to help you relax. D. Take naps throughout the day to ensure you get enough rest. Answer. B. Avoid caffeine and nicotine in the hours leading up to bedtime. Rationale. Caffeine and nicotine are stimulants that interfere with the ability to fall asleep, so they should be avoided close to bedtime. 142. A nurse is caring for a patient with a pressure ulcer. Which of the following interventions is most important to promote healing? A. Clean the wound with an antiseptic solution. B. Keep the wound moist and covered with an appropriate dressing. C. Apply heat to the wound to promote blood flow. D. Apply topical antibiotic ointments frequently. Answer. B. Keep the wound moist and covered with an appropriate dressing. Rationale. Keeping the wound moist promotes faster healing and reduces pain. 143. A nurse is caring for a patient who is at risk for developing deep vein thrombosis, DVT. Which of the following is the most important prevention strategy? A. Administer anticoagulant medications as prescribed. B. Restrict fluid intake to reduce swelling. C. Encourage the patient to remain on bed rest. D. Ensure the patient wears compression stockings. Answer. A. Administer anticoagulant medications as prescribed. Rationale. Anticoagulant medications help prevent clot formation and reduce the risk of DVT. 144. A nurse is caring for a patient with a wound that is healing by secondary intention. Which of the following is most important to prevent infection? A. Keep the wound clean and dry. B. Apply a dry dressing to the wound. C. Keep the wound covered with moist dressings. D. Expose the wound to air to speed up healing. Answer. C. Keep the wound covered with moist dressings. Rationale. Moist dressings promote healing by maintaining an optimal environment and preventing infection. 145. A nurse is caring for a patient with a history of chronic pain. Which of the following non-pharmacological interventions is most effective for pain management? A. Encourage the patient to rest in bed all day. B. Promote relaxation techniques such as deep breathing and guided imagery. C. Advise the patient to avoid movement to reduce pain. D. Provide distraction with loud music or television. Answer. B. Promote relaxation techniques such as deep breathing and guided imagery. Rationale. Relaxation techniques help manage pain without the use of medications and promote overall comfort. 146. A nurse is caring for a patient with osteoarthritis. Which of the following is the most important strategy for improving mobility and managing pain? A. Limit the patient's physical activity. B. Encourage weight-bearing exercises and joint strengthening. C. Advise the patient to rest in bed to prevent joint strain. D. Recommend the use of heat and cold therapy only. Answer. B. Encourage weight-bearing exercises and joint strengthening. Rationale. Weight-bearing exercises and joint strengthening help maintain function and reduce pain in osteoarthritis. 147. A nurse is caring for a patient with a history of stroke and limited mobility. Which of the following is the most important intervention for maintaining safety? A. Use physical restraints to prevent falls. B. Encourage the patient to use assistive devices such as a walker. C. Restrict the patient's fluid intake to prevent dizziness. D. Ensure that the patient remains in bed all day to avoid falls. Answer. B. Encourage the patient to use assistive devices such as a walker. Rationale. Using assistive devices helps improve stability and reduce the risk of falls. 148. A nurse is educating a patient with diabetes about foot care. Which of the following statements indicates understanding? A. I should inspect my feet daily for cuts or wounds. B. I should wear tight-fitting shoes to avoid blisters. C. I can ignore any foot injuries because they heal quickly. D. I should soak my feet in hot water daily. Answer. A. I should inspect my feet daily for cuts or wounds. Rationale. Regular foot inspection helps identify potential issues early, preventing complications such as infections. 149. A nurse is caring for a patient who is at risk for malnutrition. Which of the following interventions is most important for improving nutrition? A. Offer the patient high-calorie, high-protein foods. B. Limit the patient's intake of fluids to increase hunger. C. Recommend complete bed rest to conserve energy. D. Offer the patient low-fat meals to prevent heart disease. Answer. A. Offer the patient high-calorie, high-protein foods. Rationale. High-calorie, high-protein foods help meet the nutritional needs of patients at risk for malnutrition. 150. A nurse is caring for a patient with constipation. Which of the following interventions is most likely to improve bowel function? A. Encourage increased fluid and fiber intake. B. Administer an enema immediately. C. Advise the patient to avoid physical activity. D. Restrict fluid intake to prevent bloating. Answer. A. Encourage increased fluid and fiber intake. Rationale. Adequate fluid and fiber intake promotes regular bowel movements and helps prevent constipation. 151. A nurse is caring for a patient who is recovering from surgery and is at risk for developing a pressure ulcer. Which of the following is most important? A. Reposition the patient every 4 hours. B. Encourage the patient to ambulate frequently. C. Massage the patient's bony prominences. D. Reposition the patient every 2 hours. Answer. D. Reposition the patient every 2 hours. Rationale. Repositioning every 2 hours reduces pressure on bony prominences, decreasing the risk of pressure ulcers. 152. A nurse is caring for a patient who is experiencing nausea following a chemotherapy session. Which of the following is the most appropriate intervention? A. Offer the patient large meals throughout the day. B. Encourage the patient to drink caffeine. C. Offer small, frequent meals and antiemetic medication. D. Restrict fluid intake to prevent vomiting. Answer. C. Offer small, frequent meals and antiemetic medication. Rationale. Small, frequent meals are easier to tolerate, and antiemetic medication helps manage nausea. 153. A nurse is teaching a patient about the importance of hydration. Which of the following statements by the patient indicates understanding? A. I should drink fluids only when I feel thirsty. B. I should drink fluids regularly to prevent dehydration. C. I should avoid drinking fluids after 6 p.m. D. I should drink sugary drinks to stay hydrated. Answer. B. I should drink fluids regularly to prevent dehydration. Rationale. Regular fluid intake is essential for maintaining hydration and preventing dehydration. 154. A nurse is caring for a patient who has difficulty swallowing. Which of the following interventions is most appropriate to reduce the risk of aspiration? A. Encourage the patient to eat large meals at once. B. Position the patient upright during and after meals. C. Advise the patient to drink liquids quickly. D. Offer the patient only thin liquids. Answer. B. Position the patient upright during and after meals. Rationale. An upright position helps prevent aspiration and improves swallowing safety. 155. A nurse is caring for a patient who is receiving opioid pain medication. Which of the following is most important for the nurse to monitor? A. Blood glucose levels. B. Respiratory rate. C. Temperature. D. Urine output. Answer. B. Respiratory rate. Rationale. Opioids can cause respiratory depression, making it critical to monitor the patient's respiratory rate closely. 156. A nurse is educating a patient on managing chronic pain. Which of the following strategies is most appropriate? A. Use only medication to manage the pain. B. Incorporate both pharmacological and non-pharmacological methods. C. Avoid physical activity to prevent pain flare-ups. D. Only use non-pharmacological methods when pain is severe. Answer. B. Incorporate both pharmacological and non-pharmacological methods. Rationale. A combination of methods is more effective in managing chronic pain. 157. A nurse is caring for a patient who is at risk for malnutrition. Which of the following interventions is most likely to improve the patient's nutrition? A. Limit the patient's food intake to prevent overeating. B. Offer small, frequent meals high in protein and calories. C. Restrict the patient's fluid intake. D. Offer low-calorie, low-protein foods. Answer. B. Offer small, frequent meals high in protein and calories. Rationale. Small, frequent meals with high protein and calorie content help improve nutritional intake, especially in at-risk patients. 158. A nurse is caring for a patient with a wound that is healing by secondary intention. Which of the following is most important to monitor? A. The appearance of the wound and surrounding tissue. B. The patient's blood pressure. C. The patient's respiratory rate. D. The patient's temperature. Answer. A. The appearance of the wound and surrounding tissue. Rationale. Monitoring the wound and surrounding tissue for signs of infection or poor healing is crucial for preventing complications. 159. A nurse is caring for a patient with difficulty sleeping. Which of the following interventions is most appropriate to improve the patient's sleep hygiene? A. Encourage the patient to use electronic devices before bed. B. Advise the patient to take naps throughout the day. C. Recommend a consistent bedtime routine. D. Suggest that the patient exercise vigorously before bed. Answer. C. Recommend a consistent bedtime routine. Rationale. A consistent bedtime routine helps signal the body that it is time to sleep, improving sleep quality. 160. A nurse is caring for a patient who has a history of falls. Which of the following is most important to prevent future falls? A. Encourage the patient to remain sedentary to avoid falling. B. Recommend the use of mobility aids such as a cane or walker. C. Suggest that the patient stop taking prescribed medications. D. Advise the patient to avoid wearing shoes altogether. Answer. B. Recommend the use of mobility aids such as a cane or walker. Rationale. Mobility aids such as canes or walkers improve stability and help prevent falls.